Hi, I'm Dr. Anndrea Hatcher from Olive Branch Parke Veterinary Clinic. What should I do when my dog has diarrhea? When your dog starts having diarrhea, for mild, short-term diarrhea, withhold food for 12 hours, but offer lots of water to prevent dehydration. Then offer cooked rice and boiled chicken. If the stool is returning to normal consistency, feed the rice and chicken for 3 days. On the 4th day, mix the rice and chicken half and half with your regular dog food and return to regular dog food only on the 5th day. Canine probiotics by mouth can also be helpful. When should you call your veterinarian? You should call if the diarrhea lasts for more than a day, if your dog is less than 6 months old, if the diarrhea is black or bloody, if your dog is also vomiting, lethargic, or straining to defecate, or if your dog has recently eaten something inedible, such as string, socks, rocks, dog toys. At your appointment, it's very important to bring a recent sample of your dog's diarrhea for testing. If your dog may have eaten something toxic, bring any information, such as a product label, as well. If you are new to this veterinarian, bring your pet's vaccination records and medical history. Your veterinarian will perform a physical examination, an intestinal parasite exam, as well as potentially other tests, such as testing for Giardia or parvovirus, as well as blood work, urinalysis, x-rays, or others. Why do veterinarians perform physical examinations and run tests on dogs with diarrhea? Because many things can cause diarrhea in dogs, and there isn't a single medication that can cure every cause of diarrhea in dogs. Some of the causes of diarrhea in dogs include intestinal parasites, parvovirus, sudden changes in dog food flavors or brands, stress, such as during boarding or when leaving littermates to go to a new home, bacterial or viral infection, intestinal obstruction, intussusception, foreign body ingestion such as rocks, mulch, golf balls, engagement rings, etc., pancreatitis, eating garbage out of the trash can or table scraps or dead animals in the yard, food allergy, inflammatory bowel disease, exocrine pancreatic insufficiency, especially in German Shepherds, liver or kidney disease, cancer, prostate disease, heat stroke, malabsorption, coronavirus, cryptosporidius, histoplasmosis, protothecosis, intestinal ulcers, and many others. How can you prevent your dog from getting diarrhea? Get a regular intestinal parasite exam done on your dog as recommended by your veterinarian. Use monthly heartworm preventative year-round. Many brands of heartworm preventatives will also prevent or control some of the most common intestinal parasites. Keep your dog's vaccinations up to date as recommended by your veterinarian. Consider that areas where lots of dogs are walked, such as dog parks, apartment public grassy areas, and designated dog bathroom areas by pet stores, may be frequented by dog owners that haven't had their dog's feces checked for parasites or that don't pick up their feces. Your pet may be exposed to parasites there. Don't feed people food to dogs. High-fat food that humans can digest without trouble can cause pancreatitis in dogs. Avoid sudden food changes. If you're going to change dog foods, mix the new food and the old food together for a few days before completely switching over to the new food. Don't give bones from the table to dogs. As dogs chew these bones, they can fracture. The sharp points can puncture the digestive tract. Keep garbage cans out of reach. Choose dog toys carefully. Avoid thin-walled plastic toys with squeakers that can be easily chewed into pieces and swallowed. And dog-proof your house, shelves, counters, garage, and yard.